I'm going to show you how to prepare and administer Menopur Multidose injections. Menopur Multidose comes in two strengths, 600 units or 1200 units. For the purpose of this demonstration, I'm going to show you the 1200 units. The main difference between the two is that the 600 units will only have one syringe full of fluid to mix with, whereas the 1200 units will have two syringes. When you open the box, you will have a box of syringes, which contains syringes as this, and you will have a tray. Remove the tray from the box and peel it open, and remove the contents of the tray. For the 1200 units, you will have an ampule, and inside the ampule will be the powder, which is the medication drug. If you flick with your thumb the dust cap off the top of the ampule, take your first syringe of fluid and take the administration needle here. Remove the hub and remove the cap from the fluid and push the two together firmly. Please make sure the needle is on firmly, otherwise the liquid will leak out the sides of the needle. And then remove the cover on the needle. Take your ampule and hold it firmly and place the needle through the middle of the rubber bung. Push down on the plunger so that the fluid inside the syringe enters the ampule. And then remove the syringe and needle from the ampule. Take your second fluid syringe, remove the cap, remove the needle, and attach it to your second syringe. And do the same as you did before. Push the needle through the middle of the rubber bung, push down on the top of the plunger so that the fluid enters the ampule. Once all that is in, just remove the syringe and needle and you can dispose of that into your sharps bin. Just mix your ampule gently, just by swirling, and you'll see that the powder dissolves very quickly. The fluid in the syringe should be clear. And you are now ready to administer and prepare your syringe for administration. Once you have mixed Menopur, it will actually last for 28 days. If it goes beyond 28 days, you should dispose of the ampule. Your doctor will have prescribed you your dose, and on this syringe, the units of the dosage are written down clearly. So these are not a volume, these are the dosage that you will administer. So for the purpose of this demonstration, I'm going to go to 225 international units. Once you've removed the cap off the syringe and needle, push it through the middle of the rubber bung, and then turn your vial and needle upside down so that the top of the needle is covered by the fluid. And then pull back on your plunger and you'll see the fluid enter into the syringe. It's worth going past your dosage that you actually want. You can actually let go of the ampule there, it will stay, it's quite firm. And then once you've got the fluid in your syringe, just give it a tap and any air bubbles will come to the top. And then push up back past the dose that you want. And there we are at 225. Remove that and you're now ready to administer your Menopur. Menopur is given by subcutaneous injection, either into the abdomen or the thigh. When you're ready to give your injection, pinch the skin so it comes up slightly and insert your syringe with the needle in a firm motion at 90 degrees. Insert the needle all the way up to the hub. Put your finger on the end of the plunger and depress steadily until all the fluid has gone in. Just hold the syringe and needle there depressed for a few seconds. Then you can remove your needle and release your grip. Each syringe and needle is used for one injection only, and then this should be disposed of, and each time you give a dose you will use a new needle and syringe.